Over 50% of adults over 65 snore regularly. Most blame it on weight, sleeping position, or just getting older. Your doctor asks about your sleep maybe once a year, writes down reports snoring, and moves on. But a 2023 study in the European Heart Journal found that untreated sleep apnea after 65 doubles the risk of atrial fibrillation, triples the risk of stroke, and shortens average lifespan by 8 to 12 years. Snoring is not just annoying. It is your airway collapsing. And every time it collapses, your heart takes the hit. I'm Dr. Garrett Thornton, 34 years in internal medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. It is 2 in the morning. Your spouse shakes your shoulder. You snorted so loud it woke them up. You mumble an apology, roll over, and fall back asleep. This has happened 3 times a week for the past 5 years. Your spouse has started sleeping in the guest room. You joke about it. They stopped laughing about it a year ago. You feel tired during the day. You doze off in your recliner after lunch. You wake up with a dry mouth and a headache. You blame it on age, but it is not age. Something is happening every night that you cannot see, cannot feel, and cannot hear, and it is slowly damaging your heart, your brain, and your blood vessels while you sleep. The myth is that snoring is harmless. The reality is that snoring is the sound of a partially obstructed airway. In mild cases, the tissues in your throat vibrate as air squeezes through a narrowed passage. In severe cases, the airway closes completely. This is obstructive sleep apnea. Your breathing stops for 10 to 30 seconds, sometimes longer. Your blood oxygen drops. Your brain panics and sends a burst of adrenaline to force you to breathe again. You gasp, your airway opens, you resume breathing. This cycle can happen 30, 50, even 80 times per night. You do not remember it. But your body remembers every single episode. Think of your heart like a car engine running on a highway. Normally, it hums along at a steady pace all night. With sleep apnea, imagine someone reaches over every 90 seconds and turns the ignition off. The engine dies. Then it restarts violently. Off, on, off, on, all night. Every restart floods your system with stress hormones. Your blood pressure spikes. Your heart rate jumps. The walls of your arteries take microscopic damage from the pressure surge. Over months and years, this creates chronic inflammation, stiff arteries, and irregular heart rhythms. After 65, your heart is less able to absorb these repeated shocks. The damage accumulates faster. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. Let me tell you about Robert. Robert was 71 years old, retired plumber from Charlotte, North Carolina. His blood pressure had been climbing for 3 years. His doctor added a second medication, then a third. His blood pressure still would not come down below 150. Robert was frustrated. He was taking his pills. He was cutting salt. He was walking. Nothing worked. His wife mentioned to the doctor that Robert snored terribly. She said she could hear him through 2 closed doors. The doctor ordered a home sleep study. The results? Robert stopped breathing an average of 42 times per hour. Severe obstructive sleep apnea. Every time he stopped breathing, his blood pressure spiked 30 to 40 points. His average nighttime blood pressure was higher than his daytime readings. No medication could overcome what was happening during those 7 hours of sleep. Robert's resistant hypertension was not a medication problem. It was a breathing problem. Here is your first test. Ask your spouse or whoever sleeps near you 3 questions. First, do I snore most nights? Second, have you ever noticed me stop breathing and then gasp? Third, do I seem restless in my sleep, tossing and kicking more than usual? If the answer to the first question is yes, and either of the other 2 is also yes, you have a high probability of obstructive sleep apnea. If you sleep alone, record yourself sleeping for 1 night using your phone placed on the nightstand. Play it back in the morning. Listen for repeated snoring interrupted by silence followed by a gasp. Here is your second test. The Epworth Sleepiness Scale is a validated screening tool. Ask yourself how likely you are to doze off in 8 situations. Sitting and reading, watching television, sitting inactive in a public place, as a passenger in a car for an hour, lying down in the afternoon, sitting and talking to someone, sitting quietly after lunch, and in a car stopped in traffic. Rate each 0 to 3. 0 means never doze. 3 means high chance of dozing. Add up the total. Above 10 means you are excessively sleepy during the day. Above 15 means you likely have significant untreated sleep apnea. Things that make sleep apnea worse after 65. First, sleeping on your back. Gravity pulls the tongue and throat tissues backward, narrowing the airway further. Back sleeping doubles the number of apnea episodes for most people. Second, alcohol within 3 hours of bedtime. Alcohol relaxes the throat muscles, making collapse more likely. Even 1 glass of wine can increase apnea episodes by 25%. Third, sedating medications. Sleep aids like Ambien, benzodiazepines like Ativan, and some antihistamines relax the airway muscles. They help you fall asleep, but make the apnea worse. Fourth, untreated nasal congestion. If you breathe through your mouth at night because your nose is blocked, the airway is more prone to collapse. Here is what helps. First, positional therapy. Sew a tennis ball into the back of a sleep shirt. This prevents you from rolling onto your back. It sounds low-tech, but it reduces apnea episodes by 50% in positional sleepers. Second, elevate the head of your bed 4 to 6 inches with bed risers. This tilts your whole body and reduces airway collapse from gravity. Third, a CPAP machine. If your sleep study shows moderate to severe apnea, a CPAP is the gold standard treatment. Modern CPAP machines are quiet, small, and the masks are far more comfortable than they were 10 years ago. Within 1 week of consistent use, most patients report better energy, lower blood pressure, and fewer headaches. Fourth, nasal strips or a saline rinse before bed. Keeping nasal passages open reduces mouth breathing and improves airway stability. This is the Thornton Sleep Heart Protocol. Step 1. Do the spouse interview and the Epworth Sleepiness Scale this week. If your spouse confirms gasping episodes or your Epworth score is above 10, call your doctor and request a home sleep study. Home sleep tests are now simple, affordable, and covered by most insurance. You wear a small device on your finger and chest for 1 night in your own bed. Step 2. Stop sleeping on your back starting tonight. Use the tennis ball method or a wedge pillow to keep you on your side. Step 3. Eliminate alcohol within 3 hours of bedtime and ask your doctor whether any of your medications could be worsening sleep apnea. Robert started CPAP therapy within 2 weeks of his diagnosis. The first night, he slept 7 hours without a single apnea episode. His wife said the silence was shocking. Within 6 weeks, his blood pressure dropped from 150/92 to 128/78. His doctor removed the 3rd blood pressure medication. At his 6-month follow-up, Robert's morning headaches were gone. His daytime sleepiness was gone. He stopped napping in the recliner. He told me that one sleep study changed his life more than 10 years of blood pressure pills. Write your age below. And tell me, does your spouse say you snore? Have they ever heard you stop breathing? I read every comment. Here are your 5 takeaways. 1. Snoring after 65 is not harmless. It may be sleep apnea damaging your heart. 2. Ask your sleep partner about gasping or breathing pauses. 3. Score yourself on the Epworth Sleepiness Scale. Above 10 means get tested. 4. Stop sleeping on your back and eliminate bedtime alcohol. 5. Request a home sleep study if you score high. I made this channel for one reason. The information your doctor knows but does not have 12 minutes to explain. I don't sell supplements. I don't have a clinic. I profit from you not needing me. If this made one person get a sleep study, it was worth making. I'll see you in the next one.